Ectopic pregnancy is the fertilized ovum develops at a site outside the uterine cavity. The fertilized ovum may implant in various sites of outside the uterine cavity. Example in tubal or in rudimentary horn or abdomen or ovary or cervix. In tubal pregnancy, there may be the fertilized ovum get implanted in the interstitial or isthmic or ampullary or infundibular portions. So in this condition, we can get the patient complaints of abdominal pain, amenorrhea and vaginal bleeding. Investigation includes UPT and ultrasound examination. Management of tubal pregnancy, it may be medical or surgical. In ruptured ectopic pregnancy, surgery is the only option. In unruptured, we can go for medications. Medication includes methotrexate is the drug of choice, and methotrexate is contraindicated if the beta HCG level is greater than 5000 unit IU and fetal cardiac activity is present, or if there is any immunodeficiency or liver disease present. Indications for methotrexate is active bleeding. The size of gestational sac should not exceed more than 4 cm. Absence of fetal cardiac activity. Beta HCG level less than 5000 international units per ml. Then surgical treatment includes salpingectomy, immediate laparotomy and salpingectomy with simultaneous resuscitation measures. Then abdominal pregnancy. In abdominal pregnancy, fertilized ovum implanted on the peritoneum in extremely, and it is extremely rare condition. It is diagnosed by Studiford criteria, that is presence of normal tubes and ovaries with no evidence of recent or past pregnancy, no evidence of uteroplacental fistula, the presence of pregnancy related to the peritoneal surface and early enough to eliminate the possibility of secondary implantation. Next, it can be diagnosed using X-ray examination, ultrasound examination. Treatment includes surgery. Then ovarian pregnancy, it is very rare, and fertilization occurs in the Graafian follicles or fertilized implants directly to the ovarian tissue. Then it can be diagnosed during laparotomy. The fallopian tube on the affected site must be intact. The gestational sac must occupy the position of the ovary, and gestational sac is connected to the ovarian ligament. Then cervical pregnancy, it is regarding the implantation of fertilized ovum in the cervix. It may be in the endocervix, which is the endocervix is eroded by trophoblast. During this pregnancy depends on the higher the implantation, greater is the capacity to grow. Diagnosis is made by ultrasound examination, and uterus is seen to be empty and gestational sac is seen in the cervical canal. Treatment is usually surgery, diagnosed using Rubin's criteria. Uterus is smaller than the cervix, internal os is not dilated, external os opens earlier, and curettage of the endometrial cavity is non-productive of placental tissue.